As I plan for retirement, I'm preparing for one of the biggest and most unpredictable expenses, healthcare. It's not just about having coverage. It's about understanding what I might need, what it might cost, and how I can build a plan that supports both my health and my peace of mind. Retirement isn't just about freedom of time. It's about freedom from worry, and healthcare planning is a cornerstone of that freedom. I started by reviewing my current health insurance and exploring what changes once I retire. I've looked into service providers and plans and how it covers basic hospitalization and treatment. I've also considered upgrading to an integrated shield plan for broader coverage, especially for private hospital care. I want to make sure I'm protected not just for emergencies, but for chronic conditions and preventive care too. Because health isn't just about surviving, it's about thriving. And thriving requires more than a safety net. It requires foresight. Foresight to plan for care before it's urgent, to invest in wellness before it's depleted, to choose rhythms that sustain rather than exhaust. Retirement gives me the chance to see health not as a checklist, but as a legacy of strength, of balance, of vitality, so that the years ahead aren't just endured, but embraced. Next, I factored in out-of-pocket costs. Even with insurance, there are deductibles, co-payments, and treatments that may not be fully covered. I've built a healthcare buffer into my retirement budget, a dedicated fund for medical expenses, including dental, vision, and wellness services. It's not just a safety net. It's a way to stay proactive and reduce stress when unexpected bills arise. Having that cushion means I can focus on healing, not worrying. It also means I can say yes to preventive care. The checkups, screenings, and therapies that keep small issues from becoming big ones. Long-term care is another layer. I've explored those plans which provide payouts in the event of severe disability. Because foresight isn't just about protecting assets, it's about protecting dignity. It's about ensuring that if the unexpected comes, my family has support and my future has stability. Retirement planning isn't only about today's rhythms, it's about tomorrow's resilience. And long-term care is one of the ways I choose to honor both. I'm also considering supplemental plans that offer higher benefits or more flexibility. It's not easy to think about needing help with daily activities, but planning for it now means I can make choices later with dignity and control. Long-term care isn't just about cost, it's about quality of life. It's about ensuring that if I need support, I'll have options that align with my values. And that planning gives me peace, knowing I won't be caught off guard. I've also looked into lifestyle factors that influence healthcare costs. Staying active, eating well, managing stress, these aren't just good habits. They're investments in my future health. I've built wellness into my weekly routine, not just as a goal, but as a strategy to reduce medical expenses over time. A walk in the park, a balanced meal, a moment of mindfulness. These are small acts today that can save me from bigger challenges tomorrow. Retirement gives me the gift of time, and I want to use that time to invest in my health, not just my hobbies. Because health is the foundation that makes every hobby possible, every connection richer, every day more vibrant. Investing in my well-being means choosing rhythms that energize, practices that restore, and habits that sustain. In this season, health isn't just maintenance, it's momentum. Momentum that carries me into the years ahead with strength, vitality, and joy. Another part of my planning has been conversations. I've talked with friends who've already retired, and their stories remind me that healthcare planning is deeply personal. Some chose minimal coverage and rely on savings. Others invested in comprehensive plans for peace of mind. Hearing their experiences helps me weigh my own priorities. It reminds me that there's no one-size-fits-all solution, only the plan that fits my life, my family, and my values. Finally, I've documented everything in my retirement binder: insurance policies, contact info, renewal dates, and notes on what's covered. I've had conversations with loved ones about my preferences and plans, so they're informed and prepared if support is ever needed. These conversations aren't always easy, but they're acts of love. They ensure that when the time comes, my family won't be left guessing. They'll know my wishes, my plans, and my priorities. And that clarity is as important as the coverage itself. So this week, I'm planning for healthcare costs with clarity and care. I'm building a financial cushion, reviewing my coverage, and making choices that support my long-term well-being. Because retirement isn't just about freedom, it's about feeling secure, supported, and ready for whatever comes next. Healthcare planning, in the end, isn't about fear. It's about peace. It's about knowing I've prepared for tomorrow so I can live fully today. And that, to me, is the true gift of retirement. Not just more time, but more confidence in how I'll spend it.